Hello, good evening, everyone.
Good evening.
We are just going to wait a couple more minutes, like I said, till just about 7:05 or so. We're just about reaching there, so that everyone has a chance to log in. And I will introduce the lovely gentleman on both sides of me. Very excited this evening. This will be our very first webcast hosted by SharpMinds. We'll do a brief introduction. We'll go through the agenda a bit. This is meant to be conversational. This is meant to be a real life discussion with some hands-on application and really a story of a tremendous legacy, that our guest speaker will be attributed to. So I think that we will probably get started as we see more people, more attendees coming in. So ultimately, we'd like to welcome everyone to our very first webcast. So please bear with us as we kind of go through some of the technological challenges of our first broadcast, hopefully the first of many. But we're so thrilled and honored to kick off with a very esteemed guest speaker. On behalf of myself, my name is Catherine Borge, and I'm one of the co-founders of SharpMinds. I'm also the Chief Commercial Officer. To my left, I have our CEO and founder, Mr. Amir Greiss, joining us, sharing some of his expertise. And then to my right, we have a very distinguished guest speaker, Dr. Scott Kennedy, who will bring just really a tremendous insight into his family's legacy, what that has meant to the healthcare landscape of UAE, especially to the Al Ain community, and an institution out in Al Ain that our very own Amir has contributed to the design to. So ultimately, if you're not aware of what SharpMinds is, we're a multidisciplinary consultancy firm, and we focus on design services across sectors. But all of us sitting here have a very special connection to healthcare. So that's what we'll try to focus on a little bit, share some real life applications and a bit of theory focused on human-centered healthcare infrastructure design. And hopefully everyone will find it valuable, maybe a little bit humorous, hopefully practical, and really we're all just here to have a nice discussion. So you're more than welcome to share some questions that we'll hopefully be able to get to at the end. Again, we're so appreciative for everyone who have logged in, and we'll just get started. As I mentioned, this is a bit of our agenda here. We'll go through a bit of the key principles of what does human-centered design mean. It's much more than just a buzzword. What does that mean from the foundational concepts to how we actually apply that in various healthcare spaces, whether it be a polyclinic, whether that be a complex hospital, whether that be a fertility clinic, maybe a bit into research and development labs. A lot of these foundational concepts are apparent for so many different applications and sectors. Then we will dive into one of our case studies, the Oasis Hospital legacy, and what that's really meant for the landscape here in UAE, as we've mentioned, and how we've really evolved human-centered design from its conception in the 60s through modern times, having a chance to hear some insights from our very own Dr. Scott Kennedy. And like I said, please feel free to share some questions, and we'll hopefully be able to answer some of them. So again, thank you everyone for joining. I will hand it over to our very own Amir Greiss from his perspective as an architect and medical planner.
Thank you, Catherine.
Absolutely.
Of course, an honor to be with Dr. Scott on our first webcast. So I think part of this discussion is just touch base on some of the buzzwords that we use and we hear a lot about design and about architecture, about healthcare, human-centric design in particular. And we would try to describe the process that we go through, making sure that those are not just buzzwords, but are actually more of a principle in design that would help serve patients in a better way from a design perspective, but also from a clinical perspective, and how those words actually translate into a space planning approach. So we'll go through a couple of points just to illustrate what the core principle of human-centric design is. So when you really think about it, it's more about accessibility and inclusion. We build facilities that serves patients primarily, but it also serves their families, the doctors, the nurses, the staff that work in the facility, from top management to the first line of actual service for the hospital. So making sure that our buildings or our facilities are accessible and they provide the inclusion from all aspects. Those are very, very important aspects when it comes to healthcare design. One of the things that we also look at that is a buzzword as a sustainable design, but I don't think that we're talking about environmental sustainability only. We were having a discussion right before the webcast about the impact of space adjacencies for doctors, for nurses, the amount of travel that they actually do to actually be able to serve a patient. When we look at these aspects, it makes the journey much more appealing and welcoming, even to the staff, not just to the patients and the user of the facility. Again, flexibility of space, like you were saying, doctor, when we went through the discussion together and you went back and looked at some of the aspects of design, that those are not just space planning aspects, those are actually patient experience that you are looking at because you really want the best for your patients and you want them to be able to actually have a nice experience and interaction within your facility as a design. And then the last point is like empathetic design. Like we said, having an easy flow of a facility, especially working in the UAE when we have different type of nationalities, different type of backgrounds. Sometimes your patients, they have spent time in the country, they can communicate, but as a doctor, you also are dealing with patients that might not have the same language, same background. So how your facility is designed and you have the tools to actually serve them in an efficient manner without making them feel unwelcomed or anxious or they are uncomfortable or they cannot even express themselves. So it's part of creating an environment that actually serves your patient in the best way. I mean, I've never seen a person that can express himself the way that you do, but that's one of the key success aspects that we're honored to have you with us here. So those, like talking about very, very simple aspects of design that you can tangibly see and feel in hospitals that are part of the human-centric approach. Natural lights and greenery, clear wayfinding, and also cultural sensitivity. We know that privacy, like we discussed right before the webcast, in this part of the world, and especially in the UAE, and we would dig more in depth in the community of Al Ain, the cultural sensitivity is something that people really think about before getting into any healthcare facilities. Even the way that you discuss with your patients, your approach to them, it makes them feel that they are the focus of your attention, of your service, and that they are part of an actual journey that you share with your patients. So those are some aspects that principles that build actually the experience that you deliver to your patients.
Right. I think ultimately, I mean, we're helping to facilitate that provider-patient relationship. I mean, obviously, you know, whatever we can do to contribute to that is so important. It's something that we take very seriously, and I know that everyone really feels passionate, you know, about this, whoever is in medical planning. So we put ourselves in the shoes of, we've all been patients, we've all felt vulnerable at one time or another and needed to seek care. And how do we do that in a comfortable manner and imagine putting ourselves in everyone's shoes? And I think that that's so important.
I think one of the important aspects of this webcast, being honored to have you with us, is a real life example of patient-centric and focused service that actually created the legacy of Oasis Hospital. With no resources, with barely anything, you could still create a legacy that lived for more than 65 years that we're going to soon be celebrating through the Oasis Hospital. I was honored to be part of the design team that did the expansion of the Oasis Hospital. So I got to experience the history, and I really want the people that are attending our webcast today to hear it from your own words. You've lived the experience, you've lived the legacy, and you continue to live it and see it throughout the years. What your parents created, and you actually lived in the harshest conditions, building the legacy with almost nothing. This is something that is a true example of human-centered design. So I'll give it all to Dr. Scott, and we're all yours. We'll make it a discussion. And again, we want this to be a real life experience and just to share thoughts and ideas together. That's all.
Why don't you take us through a little bit of the snapshots here as you like?
I like the way you said that's all. We're giving it to Scott. It's a delight to be here with these two that I've just met in the last 2 months, and to be here for an hour now talking and sharing with Catherine and Amir. It's amazing. It's really, and so he submitted 3 questions to me this week that I pondered for a long time, and I realized the questions just open up big time. And the best way for me to share and answer the questions is to tell you a little bit about my story, because my story is different than, I'm not claiming to be anything special, but it's a different story. And I would like to share that bit with you so that questions can be asked of me, because he's hitting on so many topics here that are phenomenal and are very relevant to healthcare and, you know, the human. So they mentioned me, he said you, but actually the story is about my mother and father more than me. And so I grew up in this country, which was known as a trucial states, a truce between 7 states back in the early 60s. And I was 5 years old when my mother and father brought me here with my 3 siblings. And we were in the interior, about an hour and a half interior into the inner part of this emirate from Abu Dhabi, where we met with where my father had been earlier and had met with the ruler of the country.
Why don't I show some really amazing photos of that?
There you go. So, yeah, there are a lot of pictures up there with so much history and so many aspects of healthcare that come at me. So I was raised by 2 medical doctor parents who were pioneers, and like Amir said, they came in at the request of the ruler of the Eastern Province, and into a situation where we were losing somewhere around 50 to 60% of babies every month. And it was tragic deaths, and the mothers were dying too at a high rate, somewhere between 25 and 30%. So being pregnant and having a baby was really a scary phenomenon, truly. And the ruler and his brother had seen this, and they asked for the 2 doctors to come in and help out. My parents were in Jordan at the time. My father flew down first for a survey trip and for an interview, and it was a very positive interview. And so it all started then as a little child. And that's where, and eventually I'm sitting here as a medical doctor. And so that journey from 65 years ago to now comes up with a lot of questions and a lot of answers to Amir's and Catherine's questions right now. Can I stop there for a second?
Yeah, absolutely. I think that this has brought up, you know, such a legacy, and to see the evolution of how healthcare delivery has changed over decades, especially in this region. You know, yes, of course, worldwide, but how have we evolved from how we've delivered care as represented in some of these images to present day? You know, and what has transpired for the better, and maybe what could we still go back and take from the past that is still, you know, you had tremendous outcomes when your parents first came, you know, with improving that infant mortality rate. So ultimately, what worked so well back then in considering the design and experience for patients and families, what can we take today? And what really has evolved that, you know, we have been able to improve upon, maybe, infection control and sterility and hygiene and things like that incorporated into the design, maybe staff well-being as well, how we've considered the importance of needing a space to take a break from the day-to-day operations of seeing patients, maybe a very challenging conversation, like you've mentioned, and, you know, you have such great stories in the practical sense. And so I think that, you know, the Oasis Hospital, now known as Kanad Hospital, Hospital, really just is such a testament to seeing that evolution and really a testament to the importance of faith in healing and the importance of community and relationships. And that's really what's at the center of human-centered design is not coming up with maybe a technological digital innovation that can contribute and assist, but what's at the core is thinking about how different types of individuals communicate and navigate through a space.
It was also not based on actual luxury, and it was not based on a huge investment. It was more based on providing service, believing in giving people care, no matter what the conditions are. So it was out of nothing that the human-centered design was the core of it. And then everything evolved to where we are now with a legacy of more than 60 years. So that's...
Yes, boy, you hit on so many fronts there, both of you, and I want to come back to them. But I will say, so I'm looking at the spans of 65 years, and I'm looking at. We talked about this earlier, but I should let the audience know that to me, I still look back as almost a miraculous start. How did two doctors without anything except 4 kids, no equipment, no laboratory, no pharmacy, no running water, no electricity, no procurement officer, you can go on and on, no blood bank, which was critical because their focus early on was mainly obstetrics gynecology. Their purpose here, and it was mainly, again, to the Emiratis. There was not the multi-dimensional, multicultural dimension that we have now, which is a whole new landscape that you discuss, we'll get to. So it was predominantly about OBGYN saving them, saving lives. And that was the mandate from the ruler. Amazing, this guy, this ruler. I still hold him in high regard, high adoration, because he basically asked my parents to save lives. That's your mandate.
That's the core.
The core, save lives. And it was very primitive, of course. They had to bring in lamps to do deliveries at night, to do cesarean. These were lamps that you could pump up. And they bring water in from a local village by donkey, water for us. And food was being brought to us. And where was the antibiotics? Where were the medicines? Where was the equipment for doing cesarean and the medicines for doing cesarean? And you had to have a procurement officer.
You get.
And who was the procurement officer? It wasn't my mom and dad, and it wasn't us kids. I was only 5 years old. So we're playing around, and I had wonderful 2 sisters and a brother. But we're naive, and we're in an environment where we love our mom and dad, but we didn't know what they were doing back then. Miraculous work. And it took an incredible visionary who saw beyond everything and said, save lives. We don't care if you're a Mzungu or a white person. We don't care what religion you are. Save lives. That was his mandate. And that is the vision that he opened up this country, as you can tell from. So baby number 10 was Sheikh Mohammed bin Zayed, now the ruler of this country. So this is a miraculous story of a very difficult delivery turned into a blessed, miraculous baby. And from the time my mom and dad arrived, suddenly birth rates just exploded upwards from a vertical decline to a vertical rise. So that was at the beginning. And from that, lots of really wonderful practices came out that they learned about the culture. They had to learn very quickly about the culture, about the women, the men, their privacy, what they like, what they don't like. And I can tell you some really fun stories about the early days,
Go ahead, please.
For instance, the Bedouin, and I'm not, they came in and they didn't want to go home without something being done to them. And sometimes something had to be done, like an operation to remove an abscess or a mole or whatever. But sometimes you could say they were just worried well, and they just needed, you couldn't let them do that. They had to go. So my dad came up with a beautiful plan, which was to draw up a nice shot, a B12, and put it into the muscle, and it hurts like the dickens. And they'd walk out saying, wow, that felt really good.
Yeah.
That felt really good. And they go home.
Right.
Now that goes against, we in the United States, we think we're a bunch of wussies. We want no pain. So I'm not saying they want that now, but it was a delight to get to know them. And they were very hospitable. They would come in, bring eggs to us. They bring mangoes into us kids. I remember just the little things. And, bring whatever. As their patient clientele exploded to 300 patients a day. They started getting, of course, the men, the women, the children, and then animals were brought in too, from the ruling class and from the zoo and whatever. So it was a place you went to for anything, even dentistry.
It's a place of healing, no matter what background you have.
And then I wonder about, how did my mom and dad do this? They didn't have internet. They didn't have access to anything on the internet where they could check out, how do we treat a peregrine falcon with a very bad sinusitis? And these are very expensive falcons. And my dad devised a very nice way how to put drops into their little nasal openings based on humans. And it worked. And so it took a lot of ingenuity, a lot of experience, a lot of follow-up, by the way. And so Catherine and Amir, one of the biggest lessons I learned for the rest of my life is, wow, makes me tears, but they followed up with each delivery, went to their homes. And every delivery, whether it was a young bride or an older bride, whether they had triplets or single, we went and visited them. And my mom and dad would take us with them.
Wow.
And I can tell you that was a brilliant example of follow-up, because they never saw postpartum depression, which is what we see in the States a lot.
Right.
And so we're surrounding them with a lot of attention, a lot of love. And really, the love was going both ways.
Yeah.
And oftentimes the father would be having to go out work. And so we ended up filling that an extended family. And so we saw that led to, so even if a man came in with a very bad pneumonia, we'd make sure we followed up on it. And think about that in terms of the States. We send people home, but sometimes we don't follow up, and then they swing into a danger zone with the pneumonia. Well, we caught them early, and so our outcomes were better than, ironically, in a primitive system, we had better outcomes than the States because we had this incredible follow-up. And I can say that with pride.
Absolutely. Yeah.
I mean,
it's all about the actual delivery of your service. It's not only about the resources or what you do. It's what you believe as a message. It's not.
And so you think that core still is at the base of Kanad Hospital and really needs to be at the core. I mean, we've seen it across the MRID. We've all worked in healthcare for decades now.
Yeah.
So I think we've all seen that really continue as a thread through. I don't know, Amir, were there any sort of insights from what you've seen from Dr. Scott that you brought into with, the design of the expansion, where we've gone from really a 4 to 20.
I want to talk about that a bit. So before Amir does.
Oh, okay, sure.
Because I want to share some good things there, because those are good questions he asked me, and I want to get to that. But I want to say one affirmation that follow-up was important is what I'm hearing from the people now, 65 years later as a physician. I hear it nonstop. You came to our house, you saw us, the cellulitis was there, it wasn't getting better, you told us what to do, and you followed up with it, you dressed it.
They never forgot.
They never forgot the intensity of the follow-up and the love. And that is forever been etched, as Sheikh Mohammed said last week, it's etched into the mindset or the souls of this country. And that is so true.
Yeah.
And so you can even ask, so when the name change of the hospital happened, and I'm going to get to the hospital that you helped us build. We're sitting next to a genius of an architect here, so I'll tell you. So this is not all about me, this is about teamwork. But when Sheikh Mohammed at the end of 2019 decided to change the name of the hospital from Oasis Hospital, which was the name my mother and father insisted upon and gave it because we were backed up on Oasis. But by the time they had gone, and Sheikh Mohammed realized that everybody in the city and around the emirate jump in a taxi, you ask for the Oasis Hospital, they didn't know what it meant. They said Kenneth Hospital because that was the Arabic name of my father. So in the end of 2019, Sheikh Mohammed bin Zayed, in an amazing, swift act, without letting us know, changed the name, and he did it artistically. And he actually flew us children out for the event in a secretive way. We knew nothing about it.
Oh, really?
3 days before Christmas, we were flown out here. Get over here. We got a surprise. They wouldn't even let us go to the hospital. We went to a hotel in L-Line. And the next day, drove us in by limousine to the hospital where they had these big velvet curtains up there. And he basically changed the name of the hospital from Oasis Hospital to Kenneth Hospital, which is a K-A-N-A-D, which is the Bedouin name for my father and basically the family.
I think this is something that lots of people don't know, that actually Canada is actually driven from Kennedy.
Yes.
That's how the name, the Arabic version of it came.
Well, think about it. You have Ciara and Ciara T.
Exactly.
So Kennedy, and they've stuck to Kenneth.
Yeah.
And I mean, my room was at the front door of our house. We had no operator, a telephone operator. So at nighttime, they came banging on the door. Kenneth. And I was at the front door with my brother, and we had to go back and retrieve mom or dad in the back of the house to come up and meet the patient. It was almost always OB, and my dad refused to let my mom go at night. So my father would do the deliveries at nighttime. And we were the ones always answering the Kenneth knocks. So here Sheikh Mohammed changes the name, and the next day he drives us all into the Sea Palace. It was in December, so it was cool. It was nice. We're outside, and he basically told me, Scott, we're so glad to do this for you, and we're glad you're in the modern age and delivery. But you know what he's told me? He gave me a kind admonition. Start visiting us again. Come to visit with us, sup with us, sit with us, drink tea with us, like you used to in the day of your mom and dad. And that was a brilliant admonition. We lost it for about 10 years.
Mm-hmm.
So you may not have known it, but that was driven by our wonderful ruler, Sheikh Mohammed bin Zayed. Go on and do it, and that's what sets you apart. And actually, he knew that because that's the follow-up, the trust factor, to go see the people. And since then, there's been a renaissance of doing that now. Just want to say. Now, I do want to switch over now. So I'm going to mention a picture on the right lower quadrant before I get to Amir's. So that is, I'm only putting up there, that's sort of a busy clinic in the old rest house that was given to us, a guest house, I should say. And if you look on the left of it, there's a barasti or a arish, which is the palm branches put together there to protect the men and women's quarters.
Mm.
And so my parents trying to stay in tradition when we moved to the new hospital in 1963, 1964-ish, end of 63. We moved to the new location. They put up, to meet sort of the customary, make them feel at home, we put up these arish, or they call them barasti back there, and these walls are made out of palm branches.
Yeah.
Oh my God.
And it was looking good because the wind will blow through it and it cuts out the dust and dirt. But there was one problem. They started doing something that was very interesting, which mom and dad certainly quickly acquiesced to. We were trying to feed them at first, and we realized they didn't want our food. They wanted to bring in their own premises and cook their food, which was great. But one problem, one of them caught fire, and we all burned down. Thankfully, nobody got killed. But after that point, we had to switch to cinder blocks.
Oh.
So I need to tell the architect about that. Now, can we switch back to the previous picture? Because I got to get through Amir. So see that hospital on the right? That replaced the hospital in the middle. The one in the middle was a prefab hospital made out of aluminum, which was a centerpiece of the early years. And the men were on the right, the women on the left. And there was a trading. The women came there, not only to come for healthcare, but there was trading going on outside. It was like you came to a mall, and they were selling water or selling children's things, toys were out front. Oh, I did have a nice gathering point.
But it's a center for the community then. I mean,
so I remember before I get to Amir's accomplishment on the right, one of the things I kept hearing, which it always delight in, is my mom, the nurses would come to my mom on the busy left side up there and say, well, we got the next 20 patients, 4 of them are not even sick. They're just here on a social visit. And my mom would say, bring them in.
but that's the trust that you build in that patient.
Exactly.
Right? You want the patients to feel.
It's an experience.
So the nurses are trying to get efficiency by moving it rapidly, like you said, moving the flow. But my mom realized the value of saying hi to Aisha or Fatima or Muzi or whatever, and able to say them. And it was an easy visit to say hi. And they wanted to say hi to, who is this lady? Because my mom would take off their mask, the only woman in the world who would take off their mask. So think about this development of trust.
Right.
So instead of saying, no, I'm too busy, I'll take those 4 out to the nurses. And there were some really good nurses like Latifa and Nisa, wonderful nurses that were trained underneath my mom. But I just wanted to say that was going on. And I want to throw one other thing. So imagine being there in 1963, 64, before we even had AC. And they'd come in the middle of August in their black veils, sitting outside waiting. And that's, like you said, you want to keep the line moving because it's hot.
Yeah.
We eventually got air coolers at the beginning where you blow water over air over water. But they're sitting out there and they would stay for hours dedicated, it was like going to the mall and meeting your best friends for coffee at Starbucks, but in a more simplistic fashion. Now let's get to the most amazing thing. So about 2008, 2009, and Amir can correct me on this, comes along this hospital you see on the right, which looks like a giant wave, and everybody's given different descriptions of it. But it's actually a magnificent hospital. I went back and looked at it again because Amir had sent me these questions, and I saw all the sort of the designs in it. So the functional, so as a doctor, I look at things anatomically and physically, or I should say anatomically and functionally, or as we say, anatomy and physiology. So we're looking at the anatomy. What's the physiology? What's the design? How's the flow? How are the patients liking it? And they have delighted in it, such that I can't say right now. His third question was, how has healthcare evolved to get better from what you have? Well, we can't really get much better than this piece because it has been really a big hit.
I mean,
And I'm not trying to get Amir to get a big head here, but
It was not Amir only. I was part of a team at that time, but
what I'm trying to say, yeah, we learned a lot because there's still the same things in play. Culture sensitivity, now multicultural sensitivity.
absolutely.
right.
Having obviously places of seclusion and privacy, especially for breastfeeding. So there's all these designs that had to happen, and they're available there. And still to this day, we offer them food care if they want it, but they oftentimes choose their own. So we offer that choice up to them. And we're predominantly still OBGYN, but we're now more and more, and we're seeing multicultures. We're seeing them from all over now. We have this mandate in the hospital, which no other hospital has. We're proud of this, is that everybody needs to take 2 years of Arabic.
Oh,
Everybody should take 2 years of Arabic.
we're gonna check Dr. Scott's Arabic in a bit.
And yeah, I'd be glad to talk about
Don't
that.
take mine.
But yeah, imagine that. So when the Minister of Health, I don't want to mention that, when somebody came to our hospital, some of the leaders from Abu Dhabi came to the hospital, comparing our hospital to other hospitals, they were really moved to see that we demanded Arabic. And that is a very good thing because it really helps you reach in and share early on with somebody who's maybe going through a tough time. It's an unknown environment. And so remember, that is a part of nurturing this patient trust.
Yeah.
And it's really good. So we do have that element that no other hospital has, is 2 years of Arabic underneath the belt. And I think that's been really good.
That's such a testament to how you adjust your operations to fit the community that you're serving. It's respect,
Just putting it in
it's
place.
hospitality, and ultimately you're going to get better outcomes through that dedication because people are going to feel more comfortable in sharing more about maybe something might have given them pain.
Can I have her come work for me in the hospital?
I wish, but I'm sorry.
No, we are just so fortunate to have Dr. Scott here and speak about this legacy. There's so much that we could talk about in regards to the structure, the operations, the management, the recruitment. We've tried to kind of touch on the essence of what human-centered design is in healthcare and all the different dynamics and systems that come into play for it. But really what it comes down to is relationships, respect, trust, these kind of foundational concepts. So
you hit this on the head. I'm going to say, being here in the office, seeing your work here with all your people, you have a really neat team here. You have this, obviously you have retainability.
We're trying.
Yeah. And you have sustainability, and you have this incredible relationship I see. And that's what it's all about in working in a capacity, any clinic in a hospital, any segment of the hospital.
yeah.
So that's huge. And I like the way you articulate it. It's
Thank
really
you.
good. Really articulate.
Well, maybe this will be the first of many webcasts that we have. But we did want to try to summarize a bit so that way everyone kind of takes something from some of our amazing storytelling as well as some of our really kind of practical know-how amongst all of us. We're just trying to put some of our thoughts together, and we just so appreciate everyone's time and logging in and registering, listening to some of our pearls of wisdom, as Dr. Scott put it earlier. Here are just some of our kind of wrap-ups. Here again is, in essence of Oasis Hospital, the entrance with some design elements that you have already incorporated about some of the palms. These ones will not burn. These ones are made to endure.
Beautiful.
But I think some of of these concepts that you've already talked about, talking about the interconnectedness of various systems. If you think about the body, you think about the different systems of the body. You think about, a consultancy firm, we think about the different disciplines. We think about what is needed to serve in healthcare delivery, every clinical discipline as well as the non-clinical, the importance of support staff, an entity doesn't run on its own. You need all these different elements, and maybe different, they might not have a fancy title, right? But they might just have dedication and
no,
right?
You're hitting it on all levels. It's beautiful what you just said.
So I think that, I'm glad that I'm able to summarize this, to take the knowledge of these two brains beside me, but really the focus on interconnected components, the idea of how we think about things in a holistic way. We want to prevent waste, prevent, accidents as much as possible. It's a big responsibility all of us take on. And how do we thoughtfully integrate digital technology in this day and age? We've looked at what we have as really a rudimentary foundation, and how do we only enhance that and not detract from it? We want to still be focusing on the human, on the individual, but how do we work with what modern day and luxury and afford what we've been able to.
Digitalization and
exactly. We're so fortunate to be in the Abu Dhabi Emirate with access to all of these, different elements. But how do we use them thoughtfully and not throw everything against the wall? How do we make sure that our end users, our clients, the operators, mindfully incorporate this, and we're working alongside them.
I think one of the things that I really learned throughout the journey of working in healthcare is like designing around an actual patient journey.
Yes.
So putting yourself in the position of a patient that is stressed out, suffering from pain, uncomfortable, and is going through a place that he's not super familiar with, talking to a doctor that he probably never met before. So the idea of planning around a journey that is mostly unknown. You don't even know what's the outcome of your visit. And then the way that the example that you were giving us in your actual career as a doctor, how you deliver a message to a patient that that they wouldn't understand the technical terms, or they wouldn't be able to get the full picture, but you still manage to give them the message in a very simplistic way and a funny way as well. Those are things that actually make a huge difference in the delivery of healthcare service. So
Well stated. Like I said, I can't, just what Catherine said about the design of the human body and how I realize it all dials into your work in an architecture. I mean, it just dials in beautifully, and design. And I went into medicine because of that. So thank you.
Oh, thank you.
Thank you. I mean, really we're just so fortunate, to have you here and be able to talk a little bit more in depth about Oasis Hospital. It really does still serve as such a testament to what, human dedication is, the idea of putting human-centered, care first. It's really quite inspiring.
It's a message that has been a legacy, and it's still ongoing until today. Everyone that thinks about the hospital always thinks about what your mom and dad did. And
the proof in the pudding is when you hear the words of the ruler of the country speak.
Exactly.
It just validates everything. It's not nothing I stand on, and the stories always cause my hair to stand up.
I get the chills every time we talk about everything that happened.
I think it's, we learn from the past for the future. And so I think it's such a testament, moving forward, to take.
I mean, I hear what you're saying too, Catherine. We have these evanescent situations where we've had to move on from, but we also have some very long lasting elements that are always going to be there, in terms of hygiene, having privacy, protecting the culture and stuff like that. Yet there's a lot of modernization coming at us, and and then we get into all kinds of things there, including AI and whatever. But I don't know if you want to talk about that.
That could be our next session, Dr.
Okay. Our next topic.
So I know that we had promised we try to get to some questions. I know that we're running out a bit of time. We didn't want this to feel like you were being talked at. We'll do our best to try to take some questions maybe beforehand next time. But really, we just want to thank everyone for registering and for listening in to us. We hope that it's been enjoyable. We're happy to answer questions, maybe via email. Please feel free to reach out to us. Any queries at any time. This is